It is a quality implementation and not a quantity implementation. I think as I was told, somebody mentioned that how to improve the financial conditions. I am not going to talk on that. The practical implementation of quality improvement in orthopedics. In this 25 minutes, I am going to try to push you in this dangerous pursuit. This is what I am going to do that to you, I am trying to do that to you. Most orthopedic surgeons become rich if they marry a daughter of a rich businessman or by doing good orthopedics. Those of you like me couldn't marry rich girls. Our choice is only a good orthopedics. That's the only way you and me can become rich. Have no illusion. Nobody can have big practice by giving 50% commission to general practitioners if you do not exhibit results on bone. Those GPs will leave you because there are many who give them that kickback. So that is not the way to success. Unless you deliver an excellent orthopedics, your practice is never going to grow. So in order to be rich, one must have a quality improvement in orthopedics. And How to Be a Millionaire, I read that book when I was 15-year-old. Napoleon Hill, who has made a fortune on those 1 or 2 books. I went on saying that he will tell me, you buy these stocks, buy that stocks, buy this property, nothing. All he emphasized and told is in this book is, you must have a burning desire to be rich. The means will follow automatically. So that burning desire to be rich is the one which he mentions about, and that is the same thing is here. If you want to be a good orthopedic surgeon, good quality, only quality improvement is a passion, which one gets only if there is an intense, crazy desire to be good. Unless you have that crazy desire, you will never be good. Quality improvement in orthopedic is the best nectar for an orthopedic surgeon. When we have done a good surgery, when gloves are removed, you and all round you are happy, the patient will be happy too. I describe one incident. In my nursing home, few arthroscopists were coming and doing the arthroscopy surgery. One day I requested Anand Joshi to come. I'll give the names. One day I asked Anand Joshi to come. None of my junior staff members, ward boys, peons, ayabais knew nothing about who is Anand Joshi. He just finished the surgery and he went back. And this is the uniformly each one of those ward boys, Sahib, asked kaitari changla operation zala. All what they could appreciate is the good art which the fellow executed it. And that is what is the one which pleased each one of us. That is that ward boy also was happy at seeing that operation. Mukhi's definition of surgery, rape is when a surgeon enjoys but the patient does not. The full theory of Mukhi is, surgeon enjoys surgery but the patient does not, it is a rape. And when the surgeon and the patient both enjoy surgery, it is a sex with a girlfriend. And when neither patient nor surgeon enjoys surgery, it is a sex with a wife after a second child. The peak experience. I'll talk about this peak experience. Those of you who are not aware of what is the peak experience, let me tell you what is the peak experience means. It is described in connection with the saints and the philosophers when once in a while they experience a proximity to the Almighty during their sadhana, prayers or meditation or whatever it is. They also experience once in a while that savor that moment. That is the peak experience. All these saints and everybody, they don't get it all the time, but once in a while they get it. That we surgeons get that mini peak experience. I'm sure all of us enjoy that feeling of a peak experience when the perfect surgery is done. We know the patient is going to be okay. At the end of a bad surgery, I am miserable even if there is a small mistake. I do not think any one of us are thinking how much money is going to bring this surgery when you are on the OT table. So that peak experience at the end of a surgery is the one which you and me are so fortunate to have it, which people have to do so much of sadhanas and prayers and everything. That peak experience you can get only if the best possible surgery is done. That mini peak experience needs a lots and lots of homework. One need not have supernatural talent. Dholakia and Talwarkar were same normal human beings. They were successful not because they were more talented than most of us. I firmly believe once you and me have become orthopedic surgeons after so many screenings and so many rounds of elimination starting from KG to postgraduate, we are all a cream of a human quality. I don't think any one of us in this hall is any inferior human quality material. Difference between Dholakia and Talwarkar and today's last MS Mr. XYZ is not there. If not there, because if we compare Dholakia, Talwarkar, Chaubal, when they passed their PG examination with this new XYZ, they were the same. It is afterwards when they became successful and they accepted the things, that is when the things becomes. Amitabh Bachchan was in a film Anand, a small actor, but you could see some spark in that. Each one of us observed him in that picture and we know where he has become. So it is the path on which you become better. It is not the quality of the person, it is the path and the effort which the person does. So one can never get mesmerized by successful people. They become successful only during their working time. They were not born successful. It is their approach to work which made Tendulkar and Amitabh Bachchan what they became today. And that is what is going to be, which can happen to each one of us. We have the best possible quality of a mind which we are capable of doing that, each one of us. I have lived with Dr. Chaubal and shared many vacations with Dr. Dholakia. A few traits are very visible when you live that life, not orthopedics but otherwise. And I'll describe these incidents. We were with Dr. Dholakia and few of us orthopedic surgeons in Las Vegas in an orthopedic meeting, and we went to see a striptease show. Now that striptease show, when we went to see that, the chap brings you and he puts you into the back of the auditorium or the back of a room. There is an oval table on which the girl is dancing, a nude girl is dancing, and we are put at the back. We all were sitting at the back. After about 3 minutes, Dr. Dholakia got up. He went round that oval table and he was standing there. And because that oval table, people sit there and they are having the best possible view. And he had observed that people come, sit there, they sit for some time and go away. So he was standing there, he stood there. Till about 5 minutes time, somebody got up and he sat down there and he tells me with the finger, just come here, Tanna. I went and sat there, he says, you stand here, somebody will go away. And then he tells me, you come to see a striptease show. And what can you see from that distance? Just come here and see. This is what I appreciated that he had that quality of analysis which made him that successful. And there are many instances like this which I have experienced with Dr. Dholakia and Dr. Chaubal. They became successful because they had that art of analysis and the art of perfection which makes them very good. Dr. Chaubal, during his illness, when I operated him, I asked him, sir, why did you get operated by me? He says, it was very, very appealing to me. He says, Dr. Dholakias and Dr. Bansalis, who were the other people I thought would operate on him, he said, they are very good, but I have seen you operating with me. And I know that you will do a good job. And all of them who were there at that stage now, they've started from this. If they do a good surgery in their 30s and 40s, then they become popular. They become popular only in their 60s and 70s. They don't become that popular in their 30s. And hence, the 30s when you and me are, that is the time when you have to become, when you have to see that we are trying to pursue that excellence. And that is only that crazy mind which makes you pursue for the excellence. If you cannot dream, you cannot do it. Walt Disney. have a burning desire to be good in orthopedics. We already have a quality, as we have been through many eliminations before arriving at this stage. Means to improve will follow on its own. So first and foremost, as I want to say is, all of us are capable of achieving that peak if we have that burning desire. The people fall out. During the MBBS, each one of us are admitted at 90 plus, or today whatever 98 plus. Still in first MBBS, I'm not talking about the reserved people. All those 98 walas, still 10 of them fail. Second MBBS, still all those 98 walas and another 10 of them fail. In final MBBS, another 10 of them fail. MS, the same thing happens. Even they pass among those 98 walas. Some of them become super successful, some of them just ordinary successful. Where is the difference? The difference is on the way. On the way, if you have consistent, persistent desire to improve, then only they will succeed. Otherwise, you will just fall out on the way. The quality was the same. They were all 98%, but still, they all didn't succeed. Means to improve will follow on its own if there is a burning desire. During my Nair days, I asked many students, when will you start living your life? And the student says, once we finish this MBBS, then we'll be happy. So I will call a house surgeon. When will you start feeling? So this, all the drudgery of the house surgeon is over. Registrar, I'll be happy about it. Call a registrar, the same thing. Call a lecturer. Sir, once I have finished, once I start practicing, I am. I said, here I am. I have finished everything. I am practicing. When will I start living? It's all the thing continues. Once I make more money, once I travel world, it continues. It's never there. It is now, it is now, it is now. Unless and until you and me can live it and make it excel at this stage, things will never happen. Without continual growth and progress, such words as improvement, achievement, and success have no meaning. It has to be continuous on the way. You must enjoy on the way, you must work on the way. It cannot be that I'll do this and then start doing it. What deters one from achieving excellence? Negative thoughts. We are from periphery. We do not have all facilities. Our patients do not ask for perfections. Our patients do not have insurance. They do not have money. Last reason is the only valid reason. I'll come to a little later. Negative thoughts, we are from the periphery. That is what I think. If in a Vidarbha society I say, now how can we do? You are from a 5-star city and we are from the periphery. It is all relative. I am from Mumbai, South Bombay, which is the prime of the whole of India. Also from the periphery for some super rich compared to New York, Paris and London. I have a few patients. I say, you have a small sprain. The fellow really flies down to London to see an orthopedic surgeon for that sprain. So we are also in the periphery. Periphery is a relative situation. It's not an absolute situation. Even in Mumbai, it is said South Bombay is the best. I'm saying it because I come from there. In Mumbai, it is different. Kandivali is considered inferior to South Bombay. You will see the best of orthopedics and the worst of orthopedics in the same hospital in South Bombay. This is the X-ray from the best 5-star hospital in South Bombay. So it is not periphery, it is the individual talent which makes the difference. Wherever you are, you can execute a wonderful job. And also we'll see the best orthopedics from the deep inside Chunabhatti, that is a part of Bombay. And this lateral fracture, which was so beautifully fixed up by the surgeon, posterior plate without a fibular osteotomy, he just executed that. And this is that lateral fracture which the surgeon fixed it up so beautifully in Chunabhatti, which is not a prime situation in city of Bombay. And you have seen multiple things mucked up, operated patient in New York or London or anywhere. So it's not the situation, it's not the periphery, it is an individual. Quality of orthopedics does not depend on location of an orthopedic service. We know how people have done superb orthopedics in Miraj, even before the days of Kulkarnis and now by Kulkarnis. I am talking about those real peripheries. Miraj is a small place near Kolhapur, underdeveloped area, no insurance, but terrific will and determination of Govind Kulkarni, and who has continued after a mission hospital and established a fantastic hospital with a superb service. Same about Jamnagar in Gujarat. In Gujarat, if you go in Jamnagar, same thing has happened. He has established the fantastic things. Our Gadigune in Chandrapur, where far off. I went to Chandrapur and I said, never I'll come again here. It's so far off place. But I see Gadigune doing the same wonderful job in that small part. So, no negative thoughts. We do not have all facilities. It is a myth. All these people also went through the same dilemma. Facility needs money. Money for orthopedic facility most have. Salim, I was in Bangalore doing the workshop, and there were people who saying the same thing. Sir, we don't have a power instrument. We don't have this, so we do with the hand instrument. And I asked them, there were 15 of them. I asked them, all of you make at that time, I'm talking about 20 years back, all of you make 50,000 rupees a month? He said, sir, almost all of us make more than that. All of us have a car, some of you have a sedan, some of you have a much bigger car. He says, yes. Some of you have 2 cars, yes. Then if you have 2 cars, if you have 1 car which is 4 lakhs and 5 lakhs, why can't you buy a Manman power drill, if not any of those ones? And they said, sorry sir, that is true. But the money which is kept for the car and the luxuries is different, and money which is kept for the implants and instrument is different. This is a myth. This is a myth, absolutely. Our patients do not ask for perfection. Perfection is for our pleasure. Patient asks for no, every patient comes, they want to be normal. Patients only get benefit of our obsession of perfection. Our wives do not ask for a perfection in bed. We try to have it, it gives mutual satisfaction. Perfection is in our mind. It is not in the patient's mind. I do not believe you have to be better than everybody else. I believe you have to be better than you ever thought you could be. Ken Venturi. This is the most beautiful thing which he has spoken about. Last, they do not have money. You may not have access to the best implants if you are working in periphery, I agree, which you have in Bombay. The best instruments are not patient finance related. Best instruments are not patient finance related. They are related to our craziness for perfection. We have the money. Patients do not have, but we have the money to buy the best possible instruments. Siam I bought about 100 years back. That was the first Siam in the country. Dr. C.J. Thakkar, he bought the navigation, the first navigation in this country. Reamer irrigation, Chandok bought this. These are all crazy people who satisfy their passion for doing good orthopedics. Money is there. Money wasn't there. It is never a problem. All I say is, why I didn't buy a Reamer irrigation? Why Chandok bought it in Nagpur? Just no, it's a crazy idea. You want to be better. You want to do the job. That's the reason you do the job. Miraj, Nagpur, Jamnagar, Coimbatore, they have the best instruments purchased from surgeons' own funds. Do not buy Mercedes first. Buy that best power equipment and best instrument first. The many marks will follow from those best instruments. My practice, even today, go to instrument exhibition in all meetings. Carry 30,000-40,000 cash, pay on the spot, and buy equipment which is new, good, which you do not have. Do not count how often you will need it. Once in a few years, if one patient will benefit, our paisa vasool, that patient will generate many times more cost of that instruments. Do not count how often you need it. There is no economics in surgical instruments in orthopedics. Even if you need it once in 2 years, still if you have it, you will be the winner. Do not count how often you need it. Have a Guju Marwadi attitude. Gujus and Marwadis do not do naukari. They will start their own business, which will be small, and then put all heart in that business to succeed. Never quit. I have never met a successful person that was a quitter. Successful people never give up. Quality orthopedics and good business go hand in hand. If you have a volume of work, you can improve quality and show improvement in quality. How to get that volume is your business, your analysis. You do whichever way you like. You have to learn the rules of the game, and then you have to play better than anyone else. and then you will get the quality. Quality improvement, now you have an independent setup, our access to increase your private enterprise chances to get up. You have a decent volume of work and fierce desire to improve quality. The means to improve will always automatically come. Now I shall go through some few practices which I have found better. In your own setup, develop non-medical personnel for your own need. Most arthroscopists have those persons with them, we stay with them forever. Medical man has to progress, he has to leave. So develop those non-medical people. In your small private setup, paralyze such key people. Main OT nurse, such personal assistant and phone answering specialist. These are the three people which are most important. OT nurse, one theatre ward boy, and the phone answering person. These are the three people, you must paralyze them. How to paralyze them? I have in my clinic Sonu, who was the one who was very good. He was passed over by a friend to me saying that he is doing a jadu patta in my house, but I find him very intelligent, so you take him in your hospital. I took him in the hospital, and in the hospital I found if he worked in Bhatia hospital, he will earn a little more. So I asked him that I'll try to look for you in your Bhatia hospital because he was very good. One of my businessmen friend, I told him this is what I am planning. He says, bloody hell, you are fool. I'll pay him double the amount than what you are paying, send him to my clinic. Yes, you send him to my clinic, my business accountant. I said, why are you asking? He says, it's so difficult to find competent people. I order you pay, make his pay double, paralyze him, nobody can take him away. You have to only paralyze one person. Like this, I will say you paralyze three people. Pay them anything, whatever they cannot get anywhere outside. Three people only you need to paralyze them. They will not go anywhere. They will be with you all the time. And that is the way I feel you should do it in those small places. They can't do it in a big hospital. I went to Jaslok with one of those nurses who was very good, getting married, going away. He said, sorry sir, we cannot pay them anymore. The way you are paying him, we cannot pay that nurse that much salary in Jaslok. She had to go away because they couldn't pay her the same amount which I thought they would be paying. Orthopedics, you will need any instruments anytime. Only sterile instruments are stored in separate packages with label which all OT people can understand. No instruments are stored which are not sterile. Every instrument has to be sterile. There are no instruments which are unsterile for more than 24 hours. They will need to be re-sterilized every 10 to 15 days. If they are gas sterilized, they can remain for longer time. This is what I practice in my nursing home. No instrument, if the ward boy has kept an instrument which is visible 48 hours after it has been used, he will hide that instrument so that I don't see it. Because it is a rule of thumb that no instrument will be kept unsterile. In orthopedics, you need anything at any time. There are no instruments which are kept in sterile. Sharpen the instruments. No instrument company manufactures instruments as a sharp cutting instruments. They are manufactured in the shape of a drill osteotome. They are sharpened like our kitchen knives. My carpenter, this is how I started. He was doing a job in my clinic. He just did a few things for 1 hour, 1.5 hours, and he took all these osteotomes, drills, started sharpening them, and again started working. And I asked him, what are you doing this? He said, no, the instrument, unless they are sharp, you can't work it out. That time onwards, he comes to every 15 days in my nursing home. He sharpens all my osteotomes, chisels, and everything. And this is what I think you should do it. Drills, what sharpen? What do you have to sharpen? Drills, osteotome, chisels, periosteum elevator. I don't think anybody sharpens a periosteum elevator. Scoops, curettes, they are all sharp instruments. You have to sharpen all of them. Every city will have a dhariwalas, those sharpeners, or the carpenters. If you not find it carpenter, do it. They will do it sitting in the clinic. That carpenter of mine who is doing in my clinic, now he has started traveling. He goes to Indore, he goes to Surat, he goes to Baroda. He meets orthopedic surgeon and he tells them, he gives them my name and he sharpens their instruments. For him, Though he charges what pittance for you and me, it is a pittance he charges. For him still it is a good business. He goes around. If you want, I can ask him to come to Nagpur and other places also. He will come on his own. And most important, sharpen your minds. That's the only way you can really improve the quality. Only other human beings can sharpen another human being. No amount of books, no journals can sharpen. The key is to keep company only with people who uplift you, whose presence calls for your best. That is what it is. You have to be into the company of people who can really make you understand and can sharpen your wit. Or mind sharpening games like bridge, chess, Sudoku, puzzles, any one of them. I feel it is very important. I encourage our subordinates to talk, think and suggest. Have no illusions. Our highest degree MS or DNB does not make us most intelligent person in a small group of our clinic. Bridge tournament when I play, I come in a swanky software-driven car and go and play the bridge, and that fellow bank clerk comes into the bus in a chappal and the trouser. He comes there and at the end of the game, in between he says, "Saab, agar aapne अट्ठा खेला होता चौका के बदली में तो हम लोग जीत जाते." He is a much better player than me at that time. Don't have the illusions that since you have a swanky car and a big practice, we are more intelligent. Every intelligent is not anybody's monopoly. Even that small farmer you have seen, he is a far more intelligent than quite a few of the other orthopedic surgeons. Our ward boys and nurses can salvage us many times if you listen to them and encourage them to talk as a part of a team. Intellect is a universal gift of God to all. My OT nurse, this is a true incident, I selected a small plate for a missed second fracture. She overruled me and took out a long plate by a signal suggesting me, "Not small, sir, take this long plate." Then goes near the X-ray and points out a second fracture I had missed. No one except me and she realized what was happening. We looked at each other. I thanked her with my eyes. She just nodded with the eyes. And I was saved purely because she was allowed to talk and suggest. Nobody, my assistant or orthopedic surgeon who was there, he didn't realize what happened. And this is the reason why you allow them to think. They are as sharp as you and me. And read Campbell almost all operations before doing it. You will be always find something very interesting and very new every time you read. This is the surgery which I'll say I found out many years later when I was doing. When you are doing the jig which you are using, if by mistake the muscle comes in between the jig and this lower end, it will not go at 135. This was mentioned in Campbell exams, past and everything. But still when I was reading, when I was going to execute, I read this and I realized. Every time you read Campbell, you will find something new. Something in the normal, decent operation, you will be able to do it. 135 degree I found will not be 135 if the jig was not on the bone. I find for my update, most important is the latest edition of Campbell. And membership of an AOS, American Academy of Orthopedic Surgeons, at the cost of $400 a year. That is only 24,000 rupees. The latest and the best orthopedic practice guides are available on these AOS. I feel every orthopedic surgeon should become a member. I am not getting a commission out of that AOS. But in 24,000, you will get the best possible world literature and you will be able to practice the best possible orthopedics. At least buy a last edition of Campbell, 12th edition. Campbell 12th edition, December 22. If you read this when we are only 2 or 3 years behind, which is okay. Few will not have even an 11th edition. I hope only few, not many. In conclusion, first thing is a burning desire to improve quality of orthopedics. It will bring those mini peak experiences more often along with more money also. Every one of us is capable of best quality orthopedics, not only Dholake and Talwarkar. They were not any better than us when they started. Paralyze the best staff. Buy good instruments just because it exists and not because you need it. Keep all instruments sterile and sharp. Do not economize on update material. Last, Are bhai, if not anything, at least buy a latest Campbell. Thank you.